Most importantly, how are you doing?
I'm doing great. I feel so good. I thought I would be nervous coming back to work. I felt so strong and calm and happy and grateful most of all.
You were gone exactly how long?
9 weeks. So I was 7 weeks at a mental health center in Cincinnati, Ohio. It's called the Lindner Center of Hope. And I was at the CBS House, which is the lowest intensity care within the Lindner Center of Hope. And then I was, for about 10 days, they said, you should work only an hour a week. And so I was in New York City for that time, doing some therapy and doctor's appointments, and also easing back into work.
So you got about as far away from Houston as you could to deal with this.
Well, in some ways, I had to leave. And, I'll share a little bit about sort of how I ended up there. And, but first, I don't want to forget to express my gratitude to so many people who helped me in this journey and healing and treatment. And of course, my treatment team at the Lindner Center and CBS House, there was about 16 of us at any given time. And so people would come and go depending on how long they needed to stay. And I made some incredible friends, and we all supported each other. And there was group therapy and individual therapy, so learning from one another as well as the staff. Of course, my colleagues who were just incredible, and the community that's been so supportive and so encouraging. But yeah, when I started feeling depressed, I want to say when I was 24, 25, first year of law school, I ended up dropping out of law school. It's not my calling. But at the time, I was having a really tough time, and I remember feeling suicidal in retrospect. But then it kind of went away, and so I had bouts of depression since then. Now I know that's what it was, but at the time I just thought, I don't like law school, I'm just feeling bad, or, XYZ is happening. And then later, I started feeling worse and worse, I would say, over the past couple of years, maybe three, 4 years. So my therapist said, well, you ought to go see a psychiatrist. And I have to admit, I was completely biased against psychiatrists. I don't really even have a good reason why. I just thought that I'd heard horror stories about medicine, psychiatric medicine, and the side effects, and I didn't want somebody to just put me on some sort of weird medication. So for a while, I ignored that recommendation from my therapist, from my psychologist. Finally, about a year ago, so summer 2022, I went to see a psychiatrist, and I said, look, I've been feeling like this. It really started when I was in my early mid-20s, and I think I'm depressed. And he said to me, no, you're not depressed, you have anxiety. So in that time, since then, I've been feeling more and more depressed, what turns out to be clinical depression, but because he had said, you have anxiety, I and the close people around me sort of thought, well, I guess she's fine, And so anyway, it came to a point in about July, I tried resting more. I went on vacation. I went to all these cool concerts. At some point, I found myself swimming among these beautiful fish in Thailand, and I'm still feeling so down and so empty and so sad. But at the same time, I'm a happy person. I just am. I'm energetic. I'm happy. And so it was like, okay, well, he said I don't have depression, so I don't have depression. So luckily, I got dehydrated sometime in July, mid-July. I went on a bike ride, didn't drink enough water, and so I decided to go see my PCP. And around that time, I'd been feeling suicidal again, worse than ever before.
So for the last 8 years, you have been so depressed at times that you've thought about killing yourself.
Yeah, and that's why, I think if there's one thing I want folks to take away from this is that if you feel like something is wrong, I mean, deep in your heart that you're depressed, that you have anxiety, that you have an addiction, that something is just wrong, listen to that. I'm hardworking, I felt like maybe I don't have enough willpower. Maybe I would try to sort of read a lot of the self-help stuff. I love reading biographies, and so reading about other folks in high-pressure jobs or folks with careers like what I'm pursuing, or even, the kind of thing that your family teaches you that really helps lift you up. But at some point, you can't sort of self-help your way out of a true mental illness. I love exercise. I really enjoy it. And so I started exercising even more. I did an Ironman right after the election, and I loved it. I mean, I loved training for it. It was so much fun, and it was a good balance with the work. But I found out, I can't exercise my way out of it either. And just like you can't exercise your way out of or self-help your way out of a heart attack or, a broken finger, you need to seek treatment. And it's something I just entirely did not understand. And that's why I'm doing this, and that's why I want, even if I touch just one person who's, deep down they know something is wrong.
So there will be constituents and critics who say, wait a second, the woman running one of the largest metropolitan areas in the country is admitting that she's had some real serious mental health issues over the course of her entire political career. What do you say to those who are going to say, maybe she's not cut out for this?
And I've heard from a lot of people actually who have said, I understand that you would be depressed. It's a tough job. And I know they mean it. They mean well, and it's very compassionate. But if what people take away from this experience, this treatment, my desire to share, is that being a politician is going to make you depressed, they would be missing a really big, important piece. What I want to make sure folks understand is that you can have depression, anxiety, whatever it is, and have a regular job. And for me, I am the kind of person, and the reason why, I have this depression is part of it, the chemical makeup of my brain, but part of it also is just my attitude. So that's why, I had these 7 weeks of therapy essentially, because I very much I'm a perfectionist, and I'm extremely hard on myself. And so that kind of thing brings you down. So I think, if my job were to plant trees, I would decide I need to plant 1 million, So that's the first part. Second answer to your question is, that is why, it's almost like I'm a victim of my own success, right? Because I push myself so hard, and this is something like this striving, this perfectionism, this wanting to do everything right. I've had that since I was little. I remember, getting first place in first grade. And so eventually that catches up with you. And it meant that I was able to study at Stanford University and do incredible work and run and win. And I'm very proud of the work we've done in the county. And so, actually, it makes me very good at my job that I'm so intense, in what I do and making sure I do it well. And so the question is, how can I both do a job that I love and be healthy? And so, is it an illness and it's something that folks know about? Yes. Will some people be concerned? I'm sure there will. There's a lot of stigma around mental health, and that's part of why I want to share this. But I think the goal is for folks to see it as no different than a politician who suffers from high blood pressure, which I don't have, or has had a heart attack, which I haven't had. I'm in incredible physical health and very hardworking. My brain works at 1 million miles an hour, and now I have been treated for a mental illness, which, or somebody who is diagnosed with whatever it is.
But you're asking people to consider mental health issues no different than if you broke your leg and had to be out for a few days, or if you had a heart attack and had to be out for a few months recovering.
That's what I learned. That's how I've learned to understand it, and that's not how I thought about it, right? That's why I didn't want to go see a psychiatrist. I didn't want to take medicine. But I'm not the only one. So there was a study out of Harvard that came out recently. It says 50% of people at some point in their lives are going to be diagnosed with a mental illness. Over 60% of people, same Harvard, I think around 64, 65% of people who have a mental illness go undiagnosed. I'll tell you just from my own experience, as I've decided to make this public, I would say almost everyone that has written me has shared their struggles, or their child or their sibling. All of us, I mean, we're all kind of pretending like this isn't a problem, but it is. And I think a lot of us are hard on ourselves, and we think like, oh, I just need to whatever, go to church more, exercise more, and look, it's an illness. So I think the sooner we recognize it as an illness, as something that people have, we have these incredible brains as human beings. And in some ways, it's the price we pay for having the capabilities that we have. But it is, as a field, mental health is less developed. So it's going to take work to get there. But yes, that's my goal.
Let's walk through the last few weeks. When you had your dehydration issue with your doctor in July, how did you make the decision to leave? How difficult was it to make that decision?
It was extremely difficult. It was extremely difficult, and I do think there's a world in which I would have killed myself, and I wouldn't be here. And that's...
You would have killed yourself if you hadn't taken the leave of absence.
I think that there's a world in which that could have happened. I mean, I'll never know. We'll never know, right? It's a counterfactual. But I just started feeling so down, and it was like, I would do just fine at work. I enjoy the work, and so that was sort of covering up my sadness. Same with exercise, those were the things that I could do. But the minute something went wrong or I had some quiet time, immediately, I just felt so trapped, and I felt like, well, I exercise, I sleep well, I eat well, I have a psychologist, I have a psychiatrist. What else? I mean, what else do I do? There's no way out. So that was why it just felt like I was completely trapped. And I know that my boyfriend and my close friends, in retrospect, I say, well, why didn't you pick up on the fact? Because I told them I was having suicidal thoughts, and I had told my psychiatrist, and I told my psychologist. And I think that, at least my friends and my boyfriend say, well, we figured you were getting care. And so I want to make just a little pause here to highlight, sometimes people will tell us, I'm feeling suicidal, I'm feeling really low. And our instinct, because we're uninformed, right, is to say, oh, cheer up, you just had a baby, or you just won re-election, come on, everything's great. But it's not quite the right response. If somebody in your life is expressing that, and it takes a lot to express it, the response is you need to seek help. And if the provider is not offering the right kind of help, just like you would with, a pediatrician or an endocrinologist or whatever it is, you get a second opinion. Around the same time, I felt like I don't know what's wrong. I need to take some time off. And so I remember I called some folks that I trust, and I said, hey, is there any way I could take a leave or some sort of like sabbatical, something like that? I mean, something is really wrong. And people said, no, I mean, you're an executive, politically, you'd never survive it. And that's when, this idea that I have of paying it forward, that's where it was born, because having heard about John Fetterman's experience gave me the strength to say, you know what, I need to take time off, and I can do it. Of course, some folks said, well, he's a legislator, but you're an executive, you're in charge of emergency management. We don't have like a deputy mayor. Mayor of Houston had cancer earlier this year, last year, and so the deputy mayor took over. I don't have that, right? And so it was challenging, but I knew I love my job. I don't want to have to give that up because I have a health problem.
But there was no mechanism to allow you to step away temporarily.
So we had, my staff, not an obvious one, and politically I was told you can't do it.
And that was a big factor in your stress about this.
Well, yeah, I mean, it helped me also feel trapped. I thought, well, if I want to go away, that means I have to give up my job, but why do I need to do that? I think I knew somewhere in even though I hadn't been through this whole, 7 weeks of learning, I knew somewhere within me that it was appropriate for me to take care of myself without having to give up a job that I love. I mean, there's a reason why leave exists, health leave and maternity leave, and it's the same idea. So anyway, I was told.
But in that moment, what did you think constituents would think?
I was trying. At some point, I had to make myself stop thinking about that because I would have never left.
Okay.
So that's where I really started clinging on to the John Fetterman story. And remember, he took his leave for depression. It was like February or March. So I knew about that this whole time, but and that's why I know it's hard for people to process, what I'm trying to share, because it was hard for me to get it. So when I was going through all of these struggles of, what do I do, is when this Time Magazine article came out telling his story, again, sort of with more details. It was in an interview with him, and a friend sent it to me. And it made such a difference.
What stuck out? What did he say to you?
Well, it just kind of reminded me. It was like a refresher. And so I think that's why everyone who speaks out about this, it's that drumbeat, that drumbeat. And so it took that additional drumbeat for it to really land. Okay, he was able to get treatment. He's better. He's back. I can do it. And so I said, once I check myself into this place, there's no undoing or taking back the fact that I've been through mental health treatment. And I was really scared of that. And that just tells you the degree of shame that comes with admitting to a mental health issue. So anyway, I get there, I realize it's very welcoming, it's very lovely, and they did a lot of diagnostic work those first 10 days. So that's really what the 10 days are for. And I think that kind of gets you in the door. If they told me I had to be gone for 7 weeks, I wouldn't have gone. So they finally diagnosed me. They figured out that I needed this supplement. They figured out that I needed this depression medication at a different amount. And then they said to me, it's going to be about 10% medication, and the rest of it is going to be the work that you do here. And I would say I would say it was more like 40-60. But yes, every day for the 7 weeks after that, it was class from 9 to 4. 4 to 5 was addiction class, so I would go sometimes and I would treat overwork as my addiction, because I love working, and that was like, oh, I feel so down, well, let's just get something done. And so it was a lot of learning, and it was dialectic behavioral therapy was the main modality of therapy. So dialectic is like two things can be true at the same time. So I can be very happy to be sharing my story, but I can also feel shame, because I do still feel shame.
So that's what you're feeling right now?
Yeah, I'm feeling both things. I'm feeling relieved. I'm feeling like I'm being true to myself, and like I have this responsibility to pass on what I've learned, and I feel that I'm fulfilling that responsibility. And I also do feel shame. We had a shame class.
Part of me thought in the midst of this, or kept thinking, what does her family think of this? Because we know family drives a lot of our lives, our culture, and we know that this kind of thing would certainly cause, if not shame for the family, at least a lot of concern, not only for you, but about outward appearances. Mm-hmm. How did that factor into this? What do they make of your ongoing recovery?
It's been a journey for them too. When I first went to the psychiatrist a year ago my mom said, why are you taking psychiatric medicine? So I'd already crossed that threshold in my brain, so I just said, well, it's fine, it's necessary. But I know that a lot of families, not just in the Hispanic community, but minority communities, there is that stigma is even bigger. But look, it exists with all communities.
Sure.
And I'll tell you, I was there with all these other folks. I was the only one that was public about it. Everybody else, they didn't want their neighbors to know. Eventually it sort of got out, and I think we all realized as like, well, so-and-so told their mom, and then the mom told the aunt, and then the aunt told the community. And once it's out there, it's like, oh, okay, it's all right. I didn't want to tell my parents when I left, so I didn't. I think they found out almost at the same time as the community, and I think that was part of it, is I thought they might feel disappointed. But they were very supportive, and it has helped them understand, that this is a disease, that it is treatable. And I also had to say, there's a big part that genetics plays in this.
Looking back this summer, what was harder? Admitting to yourself you needed the help, or going public and explaining why it is you had to take a leave of absence?
The first one, for sure. And I observed that same thing with my friends at Lindner. It's getting there and doing the work that's hard. And look, it's not like I was just sitting there for 7 weeks and they were therapizing me and I was just, resting. It's hard work. Because you really have to change your mindset, and you have to be very vulnerable. They can't help you if you don't tell them what it is that's causing you so much distress. So I was at a point where I was functioning. I could have come back and done the work. I was doing the work, but I wasn't doing it at the topmost level. Yeah. And I thought that, the community deserved better.
Right. Well, that your Republican opponent last year at one point called on you to resign while you were gone, suggesting that you weren't up to the job. What did you make of her criticism?
Well, it's about stigma, right? And I do want to talk a lot more about that. And we're fighting to destigmatize mental illness. A way to move in completely the opposite direction and to stigmatize it is to politicize it. And so when she says, because you have a mental illness, you have to resign your job, when she says that to me, that's what she's saying to those that believe in her, to members of her party. So that's really what I am concerned about. And so I'm thinking, we really didn't talk about politics at Lindner, but I knew there were some folks there who were Republicans, and when I heard that, I thought of them. I said, well, what if this was the person who ran in their county and says, if you have mental illness, you can't do a job? Well, number one, it might make you push it farther down, be less likely to admit it, make people feel worse, inadequate. So, I'm quite certain that the mental illness percentages are the same for Republicans and Democrats. And I read someone said, and I think they're right, there's probably a lot of folks on both sides who could use some mental health treatment.
There's also a petition now in state district court to have you removed. You plan to fight that?
Yeah, the process, it's not a very serious thing, they're claiming incompetence and and they're, I'm not worried about it. The concern again is the message it sends, because I think folks struggling with mental illness, they might just see the headline, yeah, right? Attempt to remove county judge, and they might say, well, oh gosh, I'm definitely not telling my family about that. So we've reviewed and re-reviewed the statute, and we're quite certain it's fine. At no point was I in a situation where I couldn't make decisions or I couldn't lead the county. I always made myself available to return. I feel it was really a gift that there was no major emergency that I had to return for. And I remember thinking and talking to my staff at Lindner saying, if something happens, I got to go back. And they got it. They said, oh yes, we're ready for that to happen. And
this is a 4-year term. Yeah. You plan to fulfill your full 4 years?
Yeah, of course, and I feel better than ever now, and it's like I wish I'd done it sooner. So I'm just excited and grateful to do the job without that constant burden, that constant feeling of emptiness and sadness, and you know, it's awesome.
There are going to be a lot of people who see this, who, like you, are in their 20s, going to Stanford or somewhere in the Ivy League. They've got big goals and big dreams. And maybe they feel the itch, like you did. And they're going to get going, and they're going to get on the elliptical of life, and they're not going to be able to jump off. If somebody's watching right now thinking that, what do you say to them?
You can jump off. It's when I was feeling really down, I have a couple of friends who were in a similar place, and I remember telling them, take some time off, take care of yourself, because you can. And none of us ever thought I could, and now, I mean, y'all, if I could take 7 weeks, you have no excuses. And I do think that folks that are like me, like you and me, and we care so much about our jobs and we work so hard and we've been that way our whole lives. It's easy to convince yourself that you're in this like hamster wheel. I know what you meant when you said elliptical immediately, because that's what I felt. I would tell my friends, man, I wish I could, but save yourself while you can, is just take it before it becomes too much. And do visit a mental health professional. I mean, the biggest thing that goes really for the whole community and for folks like that is it's education and advocacy. We need to educate ourselves about what mental illness is. So I know I'm saying, get off of that hamster wheel, but what if these folks don't know, like I didn't know? So that's on us. Obviously, as government, there's a lot more work we can do there, and I'm happy to talk about that. But also, as folks who are responsible for ourselves, I would encourage anybody watching this to educate themselves. And I would also encourage anybody suffering from mental illness to seek treatment.
This had to have been expensive.
Yeah, so that's another thing is, at least for folks with private insurance, which was my case, or well, the county's insurance, but what I mean is not Medicaid or Medicare, we had to pay up front. And then irrespective of whether your insurance says you're gonna cover it, you have to pay up front and then they'll reimburse you. Up front for my initial 5 weeks was upwards of $60,000. So total, it was around $88,000. Now, this is where I stop and say, I don't have $88,000. This is a used dress. Luckily, I have my longtime boyfriend. We've been together for 8 years, and he's just means everything to me. And he was able to use his savings to pay for most of it. So we are not in a great financial position right now. We're fighting the insurance company. He's a lawyer, so he knows how to do that. But yeah, I mean, it's really tough.
Yeah. I mean, you mentioned this at the beginning, too, about the divisiveness of politics and the concern that you don't want anyone to think that if you're going into politics, you're going to end up with mental illness. But based on what you've lived through in the last 8 years or so as a public figure, based on your treatment over the last several months, is it fair to say that divisiveness may very well be putting public figures in harm's way, not only physically, but mentally?
Yeah, and well, these connect, right? If you have a mental illness, eventually that's going to take a physical toll. That stress, that eventually it gets to you. And that's another reason to seek care. I'm talking about the minority communities. I would say, well, don't talk about it. No, I'm not going to go see a psychiatrist, and I sure as hell am not going to take medicine. Once you treat it, you free yourself to be all that you can be. Otherwise, you're a diminished version of yourself. You can't compete properly with other people. Yes, I mean, when there was all of this harassment of my staff and their families, I was feeling, bad about that. seems unfair. They work so hard. They work through COVID and the winter freeze and floods and fires, and this is, they could take much more lucrative positions in the private sector, all of them. I remember feeling very badly about it. I think now that I'm on this side of it, and this was something that I worked on with my therapist, I said, at some point I'll run for office again. And at some point, people are gonna be really, really ugly again. Like, what's the worst case scenario and how could I deal with it? Hell, all of us deal with life. Someone could get sick, someone could die. And so it's just having those tools to be able to deal with hardship better, right? It's the fact that pain is a part of life, but suffering doesn't have to be. And so, yes, politics is a hard job, and especially these days, it's a hard job. And so I would say the takeaway is, if you want to get into politics, you need to have your eyes wide open, that you have to have those coping mechanisms. Because, and I'll say this, I'm not gonna say who it is or where or anything like that, but I will say, when I was trying to figure out what to do with myself, I started calling some colleagues from around the country, because I felt, and we have great friendships, we don't feel like we're in competition with each other, and so we confide in each other. And I learned from a couple of folks, I said, how do you deal with this? And more than one said, well, Judge, I drink. And I think that's what a lot of people turn to. It's an open secret. Everybody drinks in the state legislature in Texas. It's just an open secret. I, for one, I barely drink coffee, but it's learning healthy coping strategies. And on that, I do want to make a point, because my staff said, well, don't talk about the folks you're in there with. Don't say there's folks with addiction, because there's been a rumor that you were there for an addiction. And I said, look, this is about stigma, and this is about getting rid of that. I was not there for an addiction, but if I had been, so what? There were people there with an addiction, and I learned there was a woman who was there with a month-and-a-half-old baby. Of course she didn't want to have an addiction. And so they were working on the mental health issues underlying that addiction. Why is it that they have to cope? And that's really how to address it.
I heard you say something in there. One day when I do run again for office.
Right.
So that's still in the plans.
Yeah, I love what I do, and I feel like now I can handle it so much better. Before it was, no job is perfect, obviously. No job is perfect. But it did feel like I was my own worst enemy, and so hard on myself that I'd make it miserable sometimes. But then there was like, well, we're helping so many people, and I feel like I'm being true to myself. Well, now I don't have so much of the negative. So yes, we might have 12 and 14-hour meetings, and I may not always see the priorities that I believe are best, and I can handle that so much better. So I'm like, just ready to go, and I have no idea what's next. I can't give you any insight there, because I don't have it. But I do hope that I can do this for the long run. And look, I watch the elected officials who've been at it for decades, and I do admire it, and I do think, these folks clearly have some wonderful coping skills. And I asked my treatment team, I said, how come? Like, why didn't I have that? And I said, well, part of it is genetics. And so, and they're not done understanding exactly how that works. And part of it is just what you're taught. And so, in a perfect world, we can really teach all children these kinds of things and equip them to be able to get mental health care. After the pandemic, the number of kids, suicidality has gone up, addiction has gone up. We all see it. We don't have to look at the numbers. We all see it. The Texas Children's Hospital is a big children's hospital here in our region. It saw an 800% increase in kids showing up for behavioral health needs.
During the pandemic.
After the pandemic. This is 2022 numbers. This is not 2020 numbers or 2021. So this is when everything was open and people weren't wearing a mask anymore. So this mental health, it's not going anywhere. In fact, it's only going to get worse if we keep burying it.
So just to drill down on my question, Democrats outside the state, Democrats here in Texas who are hoping that maybe one day you'll do something more, you're not ruling it out?
No, of course not. No, I'm ruling it out less than ever before. if that makes any sense. I'm so
So
committed
you're
to
more
doing.
determined to do it.
I'm more determined. There we go. I'm more determined to stay in politics, to see this through. I'm really.
At
I
the
feel so
statewide
happy. I feel
level, at
so
the
blessed.
federal level?
I don't know. I mean, at this point, I love my community, and I'm more grateful than ever for my community. Look, I loved Cincinnati. I wore my Astros hat. I want to make sure people know that. But I thought it was just an incredible community. I had nice time in New York City, but I was so happy to be back and see the big sky. And so for now, I got to focus on this job, but. Folks are scared of me for a reason, right? And so I'm not gonna put those fears away just yet.